billion is going for compensation and salaries.
But with all this money being allocated to the sector, we still find some of the health, like the doctors, the nurses on the streets, complaining about not being paid.
So you see the challenge now.
Yeah.
It means the budget is not enough.
What do we do to make it enough so that the people in our health sector can be able to feel comfortable, receive their monthly income, and work on the patients that comes? What is being done about this if it's not enough?
You know, a lot is being done. We need to motivate our health workers to actually stay and work in the country and provide good health service, which they do, I must admit. One of the best staffs we have in terms of health personnel in the country, in the world, are Ghanaians. We are well trained for that. But, you know, we have not actually sat down to do a proper analysis of our workforce. And it's being done now to really assess what goes into our workforce. Before we came to power, there were so many agitations. And when the new government came, you realized what happened. They had to go on strike to get certain things done for them. And so these demands are what pushes the wage bill up. Now, when you take 16.2 billion out of the 22 billion, you are left with 4 billion. Sorry, you are left with 6 billion. And that's what you're going to share among goods and services and what we call CAPEX. CAPEX is the capital expenditure. And when you see what we put in capital expenditure, it's close to only 2 billion cedis. What can we do with 2 billion? Meanwhile, we need more health infrastructure. We need the tooling, like I said, equipment. We need more office space, equipment for them to work. There's no money. And this is the reason why sometimes they have these challenges of maintenance.
Where do we generate money from to fund it, to push into this health? Where is the money coming from?
You know, actually the money for the health sector, majority comes from the health insurance.
Okay.
So the money I've quoted is without the health insurance.
Wow.
Yes. This is what goes to the Ministry of Health, and that was approved in Parliament.
Okay.
And that's why we are now looking at the formula for the health insurance. So what we approved actually goes to the ministry. What the ministry will be using to pay all its workers, staff, the nurses, the doctors, the pharmacists, then the allied health workers like the laboratory technicians, the sonographers, then the admin staff, the accountants in the office, and then the money that goes to our agencies. There are 26 agencies under the ministry. When we talk of the regulatory, we are looking at Food and Drug Authority. We are looking at Nurses and Midwifery Council. We are looking at Medical and Dental Council. We are looking at Pharmacy Council. These are the regulatory agencies. Then we look at those who provide service. The biggest is Ghana Health Service, followed by CHAG. Then when you look at the other service providers, very major service providers like teaching hospitals, we have the 5 of them. They are all part of this budget. Okay. Then we also have the Ahmadiyya Health Agency, which is also part. So 26 of them.
Wow. That's a lot of
agencies.
So would you propose like a levy or an infrastructure levy in the health sector so that there will be some kind of income to back these monies,
and that's
that everybody can be comfortable in the space that they find themselves?
Actually, that's why the health insurance was introduced.
Okay.
To remove that financial barrier for people to access health, and for the health facilities to get some IGF inflow to enable them take care of the day-to-day expenditure on the ground. But the complaint is they don't get enough money. they don't get, it's
They
not
don't get enough money. So when people go to the health sector, there's shortage of medicine, or
precisely.
they are asked to pay.
And that's what we call co-payments. So if I'm holding a health insurance card,
Yeah.
and I go to the facility, and then I'm asked to pay, I will not be motivated to renew the card again.
No, I won't.
And so now what the health insurance is doing is to call those facilities out. In fact, and then commend those who are strictly adhering to the use of the card. And one particular hospital which is being named and applauded is Goaso, the Goaso District Hospital. When you go with the health insurance, they will treat you well. They give you drugs.
Some of us, they don't treat some of us well.
Well,
when we go with the national health insurance,
let's hear those, and let's get the reasons why they are not treating you well, so that we can call them out. Give us the evidence, and we'll call them out.
But how do we make sure that this health facility adhere to the national health insurance policy? They don't take money, and they don't. You don't go and pay. Sometimes you do show them the health insurance. You still pay the same amount that someone without health insurance is paying. And the question is, then why is there need for health insurance? Why do I have to renew if I'm not getting the kind of medicine I'm paying as someone who does not have it?
I will tell you, the new CEO, Dr. Bampo, has put in place certain structures that I admire, because apart from calling out, you will be punished. They may withdraw your credentials if you are not adhering to the rules we are asking you to adhere to. Because you sign the contract that you would treat our clients who are card bearers and bring a bill to claim what you spent in terms of service, in terms of drugs. So if you charge them and still bring us a bill, what are you doing?
Yeah.
Okay, and that's why they have set up very important structures in the health insurance scheme now to do this monitoring. You know, the good thing is, I need to get these caveats out. I was once a health insurance manager. Before coming to Parliament, I was the manager in my district and then transferred to Ho. So I understand the system very well when they say co-payment. And it's something I've been battling till I came to Parliament. But I think due to technology and ICT now, they've moved very far and are trying to minimize these co-payment issues.
All right. So the 2026 budget has increased by 5 billion since 2024, 2025. In 2024, it was 15.6 billion. In 2025, it was 17.8 billion. And in 2026, it's 22.8 billion, increments of 5 billion. Why that massive rise or increase in the 2026 budget? And this doesn't include the national health insurance. It's not included in the national health insurance. And the new Ghana Medical Trust Fund, which is popularly known as Mahama Care, is not also included in the 22.8 billion. Can you break that down for us? And why are these two not included in the 8 point? That's like another money on its own.
On this one, yes.
So break it down for us. Let us understand it. So in total, it's 11.5 billion for these two.
Yes.
So please break it down. The 22.8, what is it allocated for? And what is the Mahama Care Trust Fund doing? And of course, the national health insurance that has also not included in 22. So break these numbers down so that I and the viewers can understand that.
Thank you very much. You indicated that the monies allocated to the Ministry of Health has been going up. It's because the economy is doing well. So once we increase our revenues, we also increase the support to the ministries and agencies. And also based on the projects and plans for the government, the priority areas. And so they normally allocate more money and more revenue into those areas. Now quickly, the 22.8 billion is for the Ministry of Health operations.
Okay.
So it is for their compensation, their goods and services, and their capex. That's the capital expenditure. So it's for the ministry, the departments and agencies under it. This is the total budget for them. And we break it down into compensation. And that's why I said compensation alone for all of them is 16.2 billion. The goods and services, these goods and services are recurrent expenditures, like the fuel they use to run around, the what's it called, the stationery, computer toner, water. Of course, you have to do training for your staff, upgrade their skills, be able to do some conferences here and there. Goes into goods and services. And the goods and services alone, when I look at it, is close to another 6 billion. Then we have the capex, the capital expenditure. And one will expect that, oh, we need to build some new hospitals.
Yeah.
We need to build some maybe CHIPS compounds. We need to build some or continue some legacy projects we met. For instance, the district hospital,
Yes.
which was broken down and started. Understand there's a budgetary allocation. It is in this budget.
Okay.
Okay. There's some projects that was continued by the previous government. It's in this budget.
Okay.
On its capex.
So
Then the 10 Agenda 111 projects this government plan to continue and finish.
Okay.
Let's put on record here. Agenda 111 was started by the previous government.
yes.
They said we're going to build 101 district hospitals.
Yes.
They were going to put up 6 district regional hospitals because of the new hospitals. Plus an additional regional hospital for Takoradi, Western region, making 7. So the 101 plus the 7 gives you 108.
Okay.
Then we're going to build 3 psychiatric hospitals. 1 up north, 1 in the middle belt, and then the psychiatric hospitals down south will upgrade the Accra Psychiatric Hospital into a level. So that 3 added to the 108 gives you 111. Hence the Agenda 111. Now, the 101 district hospitals that was started, they commissioned 3 before they left, but they were not operationalized.
No, they are not operating.
So because not a single injection was issued.
Yeah.
So you don't commission an empty building and say you've commissioned a hospital.
So, but has Parliament conducted a full audit of?
It's been done by the ministry, and its report will come out soon.
Okay.
There are a lot, 101.
Yeah.
In my constituency, I have 1 there. It's only 10% complete.
So, what is the new government going to do about that?
In actual fact, the previous government did not secure funding for Agenda 111. Let's put it on record.
There's no fund.
There was no funding. They came up with a special purpose vehicle called GIF Help. And GIF is the Ghana Infrastructure Fund. Ghana Infrastructure Investment Fund. So they channeled some oil money into that fund and created a special purpose vehicle called GIF Health. So that money will be used for Agenda 111 and set up a company called the Hospital Infrastructure Group that will oversee the construction and the consultancy services of all this Agenda 111. So in my constituency, for instance, there were 3 contractors. They came very late. They didn't start early. But they had issued funds ahead. So these were the challenges. Very complex arrangement. And so you have different hospitals at different levels. And each hospital was going to cost almost $18 million. $12 million for the building, $6 million for equipment. And so the previous government spent $400 million on all they have started.
Wow.
My place 10%, some place 90%, some place 50%. So we're saying, if it is almost $20 million per Agenda 111 project, if you had concentrated on 20 of them, you have finished 20 of them, operationalized them.
Yeah.
In the 4 years that they were in power, we will now come and what? Continue with the rest. But they touched everywhere and finished
Nothing.
So we now have the onus to look for funding and continue. There's been a school of thought that why don't we put some big push there?
Yeah.
Yes.
Because it would help.
It is going to help. It will be done. But the most important thing now is, in the absence of a district hospital, how are we managing? We were managing without the district hospital. So we managed and put in the necessary infrastructure to help improve service delivery. And so, for instance, in my area, Akachinov, which shares boundary with me, have their agenda 111 at 95% complete. So the tender has been stated in the budget that they will do this year. Probably we will lobby that they should complete it. When they complete it, I don't have a district hospital. My people have the opportunity to go there. And I'm between Ho and Akachinov. So my constituents will have that opportunity to either to go to Ho or go to Akachinov. That should be what should go into the thinking and planning. And that way, we will gradually complete them and get the full service delivery to our people.
So the Agenda 111 would be continued by this government?
Definitely. And I want to put on record, one of the major statements made by His Excellency is that he will continue with every project started by the previous government. So
when is all these projects going to start? Because we do hear we will continue with all these projects.
It is started already.
We've never seen, we don't see
it. It is started.
And that has been one of Ghana's worry.
It is started.
A government will start, the other person doesn't continue. We all come and start a new project all over
again.
Yeah.
It is started. And that's why those three that were commissioned, we've gone to operationalize them down.
Oh, so they are in full operation?
Yes, because they didn't even connect electricity. They went and put a generator there to spark.
Yes, because we've seen videos of the buildings that are fully equipped,
yes,
but
there was
no workers there. And
so,
we see nurses and doctors shouting that they've not been posted and all of these things.
So these three have been operationalized.
Okay.
Now the ministry is looking at need assessment, so that even if it is 5% complete and there's need that one should be completed, they'll prioritize it and complete it. So you could see that with the 10, government needs to put in close to $200 million, which is huge. You know, so the problem with Agenda 111 is simple. There was no funding. Source of funding, and I thought it was just a political gimmick.
Okay.
They should have really, you see, they should have walked the talk by putting in the money.
Yeah.
As of 2024, we approved budgets for the health sector. Instead of $1 billion, because they needed $1.4 billion to finish all, they gave 1 billion cedis. That's what was in the budget of 2024. And so definitely, there was no way. Now let me come back to the other issue. So I've explained the 22.8. Let's look at the other source of funding coming into the health sector, which is the health insurance. And that is to remove that financial barrier. And so we created that special vehicle, which is to get 2.5% revenue, VAT, and then strictly paid to...
But there's an issue of lack of vaccine funding.
I'll come to that.
Okay.
Fortunately, I'm the board chairman for the National Vaccine Institute.
Okay.
So if you draft me there, I will start speaking. We will not end today.
No, let's finish this one. Then let's get into the lack of vaccine.
Vaccine, yes.
Yeah. So let's finish this one.
Yes. So now let me come to the health insurance.
Okay.
So per the law, Act 852, what happens is Parliament would look at the health insurance formula 3 months after appropriation. Appropriation is when we pass this expenditure we want to, the president's budget. So after passing the budget on 31st December, we have the power within 3 months to get the health insurance formula also passed and approved and passed. And so what goes into the health insurance formula? First, so the amount is 11.5 billion. Total amount. That's the revenue we will generate from 2.5% VAT collections for the year projected 2026.
Okay.
Now, because we've introduced Act 1144, which is Ghana Medical Trust Fund. And we say, in Ghana Medical Trust Fund, Mahama really cares.
Yeah.
That's why the
It's
name
called
Mahama cares.
Yeah.
That is the slogan. So in Ghana Medical Trust Fund, Mahama what? Cares. The name for the law is Ghana Medical Trust Fund and not Mahama cares. So let's get that so that nobody misconstrue and do some mischief with the name. So 20% of the 11.5 total revenue will go to Ghana Medical Trust Fund.
Okay.
And when we did the calculations, it's 2.3 billion.
Okay.
That will go to Mahama case. Then the 9.2 billion now comes to NHIA. And so the 9.2 billion, this is how we've envisaged its use. Some amount of money goes to claims payment, and that is the core purpose. The major reason why the fund was set up is to pay what? Claims. And that we've projected to spend 6.5 billion for claims payments.
Okay.
Yeah. Then, no. Let me get it right. It's 5.8 billion.
Okay.
Because I have my documents here. Otherwise, somebody would.
Let's get the numbers right.
Let me get my numbers right. Otherwise, someone tomorrow would just say, hey, Charles, you quoted the wrong figure. So the claims payments, we have, yes, for claims payments is 5.3. The 6.5 was for last year, 2025. Okay. So this year is 5.3. Okay. Now, so that's the core. And it's about 56% of the total money budgeted. If you go to the law, 10% of the 9.2 is to be given to Ministry of Health for non-core activities. It's by law. So close to 920 million cedis goes to the Ministry of Health to provide non-core activities, which is not too aligned with the health insurance or the claims payment. And I'll explain what it's supposed to do. Okay. Then the other support money goes into what? Administrative support. They pay their own staff. So their claim, their compensation and things doesn't come to the 22.8. Okay. So they take their money, they provide for it. They provide for admin expenses, training, the GOG expense, the goods and services expenditures you see. Then they also provide for construction of office buildings. If you watch, most of our health insurance offices are in rented premises. I was fortunate to have a new office built for me in my constituency. Oh, nice. So we have a very beautiful office built by the health insurance. And in fact, they just didn't build the office. They provide me the scheme to with a brand new car, a brand new pickup. Oh, wow. So they are retooling also all the offices. Okay. Yeah. So this year, they intend buying about 40 cars or more to get to all the offices, because some of the hinterland, if you see the cars, yes, it's quite a pity. They are trying to reorganize the office furniture and office computers and things to align with latest improvements in ICT in the system. So those other funds go to support these purchases and expenditures. Another very important expenditure that goes into that is the card. Yeah, the card. You have to buy the card for you to use. Yes. And so they have a very robust IT system which enables them do their work virtually, sitting at one place and monitoring whatever is going on. In the past, you used to queue 2 a.m. when I was a manager. I virtually used to sleep at my office. But today, get a star 929 hash. Yes, you just make your payment at the comfort of your home. But to be able to do that, they need a robust ICT platform for payment and for renewing and for registering. And so these are some of the areas they fund with the money. Now come to, and this year they are also giving some money to the minister to do retooling of all the how do you call it, the CHIPS compounds, the health centers. You'll be surprised. I had to use part of my fund to buy ultra scan machine.
How about beds, which
I've
is
also
also a major problem here in Ghana?
last 2 years, I visited the health center, and the bed on which the women were going to deliver, I bet you, if I'm a baby coming out, when I see that bed, I won't come. I'll return.
Yes.
So on my birthday, I changed all the beds.
But that's your personal. What's government doing about these things? Every single time people come out to complain.
Because we are using all the money to pay compensation. How much is left for infrastructure?
So why don't we allocate some fund for infrastructure?
It is difficult. We still don't have enough staff. We have over 47,000 to 50,000 nurses sitting at home. We need to recruit them.
Yes, when you complete the Agenda 111 project,
yes,
you can recruit them. But let's look at the
current situation. I will show you what is happening, which is good news.
Okay.
I'll come to that. So these are some of the areas, the machines, the tooling is needed by the minister. And I want to commend the minister for taking this initiative, because for a very long time, we've never done it. And that's why you have the rusted beds and the rusted machines.
Not enough beds. People are lying on the floor when you go to the hospital. So for him to take this initiative to retool, I support it. Even though the money we are giving him is not enough, it's a starting point. It's a starting point. Now, the 10% that goes to Ministry of Health, what do they use it for? And this is where the big one comes in. Okay.
That's what they used to pay for the vaccines.
Okay.
Now, we have a special arrangement for vaccine payments and supply. We were under a certain arrangement called the Gavi Alliance. What it does is, because we were third world country, they support third world countries with vaccines. And you pay, in the beginning, you pay nothing. They give you all the vaccines. In fact, they give you all the vaccines, they clear it for you at the port, then they add money to you to give to the nurses to go around and vaccinate our children. So you see, and they give pickups, they give motorbikes. That was how beautiful the arrangement was. And so that was why some time ago, some aid supplies came and got stuck at the port.
Yes.
And are you aware that they even pay for the clearing?
Yes, that's people send in a lot of things when they get to the port, thinking that government will be like, oh, because it's coming in to help Ghanaians and everything, it should be free. But they end up telling them that you need to pay for this and that. And they're like, okay, if I'm trying to help my country and they're asking me to pay, then let it be there.
Thankfully, the minister has set up a desk.
Okay.
That will make sure when these items come, they clear it prompt. Because you recall, when that incident happened, he was very vocal. It was sad, outrageous. And so he's putting steps to make sure that thing never happens again.
So if people are bringing in things to help the medical fraternity,
by way of education, they should go to the Ministry of Health.
Process.
Yes,
don't pay anything to anybody.
They should get the minister involved. They should let him know.
Okay.
Before they put the things on the container to come.
Okay.
So that he knows, it's not everything that we have to accept into this country. Yeah. We need to make an assessment and make sure these things are really needed. If you are bringing dialysis machines that we need so much, and it's going to help us, why not?
And beds.
And beds. Come on, much. Why not? So you need to inform him, and then he will allow his officers to now go and do those due diligence and see, get proper waiver for you, and then they will clear it. So his 10% goes into this. Now the Gavi money clears this. Then with time, Ghana government were asked to do a contribution. So it started from 5% during Kufuor's time. It went to 10% to 15%. Then along the line, they said Ghana is now middle income.
So you are no longer taking.
So you are not a third world country again. So you don't have to benefit from these concessions.
Free things.
Free thing again.
No pro bono.
No pro bono. So now, the vaccine, you have to pay more.
Wow. So
we moved from close to 15% to 28%. That was last year too.
Wow.
Then the sad thing happened. When we moved, we normally change our cedis into dollars. And this is not the first time we are giving money to the Minister of Health to pay these vaccines. It's been there from the establishment of the scheme, and this arrangement has always been there. When I came to Parliament, that's what we met, and we've been approving of it. Then in 2022, 2023, the rate we used for paying the vaccines to Gavi was 7.2 cedis to $1. We approved the formula in somewhere January, February. By June, July, that was when the CD was performing magic. It jumped to 14. And we had approved the formula using what? 7.2. So you needed more CDs now to top up to pay.
Okay.
Government did not do it. So we defaulted. And so, okay, this is what you have paid. Okay, this is the vaccines I'll give you. And that is how come we got shortage of vaccines in this country.
Yes.
And what was the consequences? The resurgence of diseases that these vaccines were supposed to cure. So today, you heard at that time, rubella, measles, coming back.
Measles coming, cholera.
All good. And so it was quite bad. In fact, we had 62.
So what are you doing to control that situation at that time?
At the time, what could we do? We could only make noise. You recall, press conference upon press conference.
Yeah.
I have those press statements all written in my mind today again. And you see, today my government is in power. We must make sure